Hello, Jonas Scholars. My name is Alicia Rossiter, and I'm a family nurse practitioner and a board-certified pediatric nurse practitioner. I'm currently an associate professor at the University of South Florida in Tampa, Florida, where I serve as the Chief Officer of Military and Veteran Affairs. I'm also retired military. I retired in 2015 after 24 years of combined service on active duty in the Army Nurse Corps and then in the Air Force Reserve Nurse Corps. Several years ago, I was fortunate to have been selected as a Bob Woodruff Jonas Veteran Healthcare Scholar and was in the 2012 to 2014 cohort. In addition, I was also selected to the inaugural cohort of American Academy of Nursing Jonas Policy Scholars, where I worked with the Military and Veteran Health Expert Panel from 2014 to 2016.
Hello, I'm Rita Doust. Currently, I'm the Associate Dean at Johns Hopkins School of Nursing. I've had the wonderful fortune of being involved with the Jonas Scholar and philanthropy programs. I want to say for almost 10 years, 9 or 10 years. I've been a faculty mentor at 2 institutions. My role with veterans is actually as a family member, as a spouse, and also a mother-in-law, but also as a provider. So I'm an acute care nurse practitioner and a practicing adult nurse practitioner in primary care. I've had the good fortune of working with, I want to say about 5 or maybe or 6 Jonas Scholars at different institutions who come from different backgrounds and different areas of interest. And what I will say, it's heartwarming to see them all excel. And I think you're meeting one today.
I can attest to the fact that being a Jonas Healthcare Scholar and an American Academy of Nursing Jonas Policy Scholar has provided me with opportunities that I would never have had if I was not a scholar. The benefits and impacts of being a Jonas Scholar have been invaluable, from the mentorship and engagement from leaders within the Jonas philanthropies, as well as with military and veteran healthcare and policy leaders across multiple arenas, to collaborations on projects, research, presentations, and publications that have really changed the way that we care for service members, veterans, and their family members. And most importantly, the friendships and collegial relationships developed with other scholars that have really continued even after completing our various scholar programs. I really believe that we are at a critical junction in regards to educating the future nursing workforce. The looming nursing shortage coupled with the COVID-19 pandemic has really highlighted the need for more nurses entering the profession and for more doctorally prepared nurses to educate the next generation of nurse leaders, educators, practitioners, and researchers. And there really is no time like the present to support nursing and nursing education. I think this is imperative that the support come from all sectors of our communities, both public and private, because every corner of every community is touched by nursing.
I think about what about nursing education, first of all, is every single nurse will care for a veteran. Every nurse practitioner will care for a veteran, whether you're pediatrics, women's health, an adult, acute, whatever those roles are, we will. But we also need the science to help us understand what are the effective therapies and what is the recidivism. So in terms of nursing education, we need to prepare individuals to work in multiple settings and to understand that veterans you will care for no matter what you do. We think about veterans and suicide risk. It's typically veterans who are not having care out of the VA because they do not have a service-connected disability. Yet they probably have touched a healthcare provider, usually 48 hours before that. So as we started thinking about this, it was, first of all, do you understand military service and the impact? What we would call the psychological or the invisible wounds? What were the physical wounds or impact? And then last, about the families, spouses, children, and even when someone is deployed, if you're active duty, every 3 years you will be deployed and then you're coming back, or if you're going away. And so those really impact the family dynamics and the care.
We really have taken a wealth of knowledge and expertise from everybody engaged in this topic from around the country. And I think, put that work into one book that we were hoping is going to serve as a toolkit. For me personally, the light bulb moment was an article that I read in JAMA called The Unasked Question. And just like the author, I realized myself that no one had ever asked me if I had ever served in the military. And when I really thought about it, I kind of even wondered myself what I would say, like, how would I answer that question? And would disclosing information have changed my service-connected health outcomes? So I knew if I was feeling this way and thinking about this, I knew there were other veterans around the country who were having these same thoughts and wondering how it could impact and change their health outcomes. And I firmly believe that mitigating that gap between supporting services in the military to support and services in the civilian sector is critically important to decreasing the rates of homelessness, unemployment, and suicide during transition from service back into the civilian sector. And as healthcare providers, and particularly nursing and advanced practice nurses, we're truly on the front lines of being able to mitigate the risks during and after transition. So hence the creation of our book, Caring for Veterans and Their Families, a guide for nurses and healthcare professionals. And as I said, we are really hopeful that this can serve as one of many tools in a veteran-centric healthcare toolkit aimed at addressing care before, during, and after transition to mitigate those gaps in support and services and to improve the overall health outcomes of this vulnerable population. We are so excited for all of you who are participating in the 2021 Jonas Walk Run for Veterans, and we thank you for participating in this event. I will be walking with you as well virtually, so hopefully we'll be able to see you in the virtual world during the walk. Rita and I really want to thank the Jonas Philanthropies for providing the top 3 fundraisers with a signed copy of our book, and it will be published on Veterans Day, so we're very excited about that. We're happy that we can share this with the top 3 fundraisers from the Veteran Walk. And we really hope that those who receive a copy of our book, that will provide you with the confidence that you need to ask that question: have you served, or do you have a family member who's ever served? And if that patient answers yes, that it will give you the knowledge and guidance to provide culturally competent care to that patient. So good luck with the walk. We wish you all the best in your journey as a Jonas Scholar.
Jonas Nursing and Veteran Healthcare has been critical to really advancing. So your work in this fundraiser is not only critical to continue the work, but to really advance it more. Now, I'm not known to be the most athletic and physically active individual, but I will be walking for this one. And we're excited, and we thank you for not only your support of Jonas Nursing and Veteran Healthcare, but in particular for Jonas Nursing.